Did you know that Alberta's healthcare system is going to become more like universal public healthcare systems that you find in Europe? So what does this mean for patients? Well, for starters, shorter wait times. We've actually been to Europe to speak with their officials and learn about their systems, and they tend to have much shorter wait times than what you find here in Canada. But it's important to dig deeper on this issue. Our think tank has followed the Alberta government's healthcare decisions for several years, and we've praised and criticized their decisions depending on what they've done. Today we're going to give you a briefing on the latest changes. The Alberta government has announced they're going to move forward with two policies that are in place in Europe right now: activity-based funding and choice in healthcare. We're also going to look at a third policy they've announced that we've actually never seen in other countries before. But let's start with activity-based funding. Right now in Canada, including in Alberta, governments often use an outdated model to fund hospitals called block funding. Each year, provincial governments send a large check to a hospital and then hope that the hospital helps a lot of patients. There's no accountability in this model. This would be like walking into your grocery store, giving them $300 and asking for lots of groceries. No one does that because there's no accountability for what you would actually get. The government's block funding approach does not incentivize hospitals to help a lot of patients. In fact, it does the opposite. Each patient that walks into the hospital is seen as someone who will use up part of the hospital's budget.
The hospitals, and this applies to all hospitals in Canada, are given block funding or global budgets once a year. That's for the administration, which is excessive, and for treating patients and buying equipment and so on. Every patient, therefore, who goes to a public hospital, whether it's emergency or whether it's for a surgery, is using up their annual revenue. So the last thing the chief financial officer of a hospital wants is patients, because they use up the revenue.
The Canadian approach also leads to more money being wasted on bureaucracy by health regions and hospitals. In Europe, they use something called activity-based funding to fund their hospitals and clinics. Instead of providing hospitals with a big check at the beginning of the year, they give hospitals money each time they help a patient. So if a patient needs knee replacement surgery, the government may pay, say, 8,000 euros for it. This provides hospitals with an incentive to help more patients, because each time they help a patient, they get more money. This approach also encourages hospitals to use the money they receive on things that actually help patients, doctors and nurses, rather than bureaucracy. Lots of better performing universal healthcare systems in Europe and around the world also use this funding model. Quebec has tried the European funding approach on a limited basis, and they've actually had a lot of success, so they're going to continue to expand how much they use it. More recently, the Alberta government has announced they too are going to move in this direction. This is very good news for Alberta patients. Now, we obviously have to wait and see how good a job the government does with actually implementing this policy, but they're certainly on the right track. Now let's talk about the second change, which is to allow more choice in healthcare. In better performing universal systems in Europe, patients can choose between using their public systems or paying at non-government clinics if they want to. They have a dual approach, two choices. In Alberta, you generally have one choice: wait for the government to provide treatment, or you have to leave the province and pay elsewhere. Government barriers make it extremely difficult for Albertans to pay for treatment if they don't want to use the public system. Of course, this makes no sense. Why would we want an Albertan to have to fly to Vancouver for knee surgery? Why not let them spend those dollars in Calgary and help Calgary's economy? Even worse, why force someone with chronic pain to have to board an airplane so they can get surgery elsewhere, away from their family? The Alberta government has announced that soon Alberta patients will have a choice just like European patients have. They'll be able to use the public system just like you can right now, or if you don't want to, you'll have the opportunity to pay for treatment at a non-government clinic. Not only will this mean more choices for patients, but those who can't afford to pay will also benefit from this policy. And that's because every time someone does decide to pay for treatment, well, they leave the public system and everyone else gets to move up a spot in line. Ultimately, the government's healthcare system will be able to use more of its resources helping those who can't afford to pay, rather than picking up the tab for wealthy patients who don't mind paying the bill. When we went to Sweden to speak with their officials about healthcare, they straight up told us that Swedish patients who pay privately end up taking pressure off of their public system.
Everybody's just paying for the big system, but then they're paying extra just to be outside it, and they're taking pressure off the big system.
Here's the important part. Every public universal healthcare system that performs better than Canada's, well, they all give patients a choice between using their public system or paying privately if patients want to. Countries like Sweden, Finland, Norway, France, Germany, Switzerland, Australia, Japan, and more. This is important because some people are fear-mongering and claiming the sky will fall if Alberta patients have a choice. Some are claiming that private clinics will steal away all the staff from the public system. But why hasn't that happened in all the other countries that I mentioned? We actually found the opposite occurs. When we were in Sweden, one official told us, when you have more employers, you end up with more employees. Right now in Canada, we sometimes lose doctors and nurses to other countries. They often don't want to leave, but when you're making, say, this much money here, and you can make more somewhere else, well, some will go for it. Think of it this way. If you're a surgeon in Alberta and you can only make, say, this much money in the public system, what can you do to increase your earnings? The answer is not much. Those surgeons are not allowed to work in private clinics on the weekends or in their spare time. So we've actually heard of cases where they will flee the province on the weekends to earn extra money in other provinces, sometimes even in other countries. Can't be much fun constantly having to fly abroad all the time. The Alberta government's new policy change will mean that outside of a surgeon's normal hours in the public system, he or she will be able to do some private surgery on the side and earn more money in Alberta. This will help Alberta retain staff, as surgeons won't have to leave the province to make more money. You will hear some claim that these healthcare reform ideas are American-style healthcare. But think about this. In Europe, you find public healthcare systems and patients have the option to pay privately if they want to. In the United States, you don't have a public healthcare system that covers everyone, but you do have private options. In Alberta, you have a public healthcare system and the government is going to allow private options. We're obviously moving closer to a European model. So why are some people trying to scare you?
This is American-style medicine. We know it doesn't work. They're gambling based on dangerous American-style rhetoric, just like they always do.
It's politics. Some people want to spend another 30 years continuing to throw money at the system and hope something finally works. But we know this approach doesn't work. The system is crumbling right across the country. Patients are suffering, even though Canada is one of the higher spenders on healthcare in the world. Now, Alberta isn't just reforming the system to address structural problems. It's also going on offense to try to catch diseases earlier. Here's an example. If you have a family history of cancer and want to get a regular diagnostic scan done to detect any possible tumors, right now you can use the public system or pay privately for a scan as long as you have a doctor's requisition. Instead of having to bother your doctor each year, you will soon be able to pay for a diagnostic scan without a requisition. And if the scan finds something, then the government will pay for the scan. This change frees up doctors' time. It helps patients be more proactive and potentially save their lives. It also helps governments, because removing a small tumor requires far fewer resources than helping a patient whose cancer has spread. There is a significant opportunity in Canada to focus on prevention and prevent diseases and other health problems from happening in the first place. So this is a very encouraging announcement from the government. Overall, these changes are quite good. Now, to be sure, we have to watch carefully to make sure that they're implemented properly. And patients should be aware that, we're not going to see the benefits necessarily overnight. It's going to take some time. But a course correction is long overdue in this country. Some Canadians have come to think that it's normal to wait a year to get your hip done or several months just to see a heart specialist. But when you travel to European countries, you quickly learn that it doesn't have to be this way.
We have some stories here from Canada where people have to wait often long periods, and the results can be quite sad. We have a case where a young patient had to wait 27 months for surgery. He ended up paralyzed permanently, young boy. This couple, they ended up going to court because they were waiting 4 years for hip surgery in New Brunswick. This lady in Regina, she considered applying for assisted death because she was having to wait so long for surgery. Is that acceptable? Like, would people in Sweden find these types of stories acceptable, or would you end up with some kind of change happening?
No, I wouldn't say that that we've heard those kind of stories here.
Having used both systems, French and Canadian, for healthcare, I'd say that the biggest advantage here in France is mostly the short period of time you have to wait for most doctors. You will not have to wait for an eternity if you have to go to the hospital. The most I've ever waited in France was, on a really busy night, was a little bit under 2 hours, I believe, while I had to wait much longer in Canada to get my healthcare.